The minority in Parliament is demanding an immediate reversal of the increased charges for dialysis treatment in public hospitals. The cost has risen from 380 Ghana cedis to 491 Ghana cedis, prompting concerns from kidney patients who warn they may not be able to afford this essential treatment. There is more in this report.
The Renal Patients Association of Ghana has voiced alarm over the dialysis price hike at Kolebu Teaching Hospital from 380 Ghana cedis to 491 Ghana cedis. This increase follows the association's opposition to a similar rise in 2023. The Minister of Health designate, Dr. Bernard Okoboy, has pledged to engage with the National Health Insurance Authority and the Health Committee in Parliament to ensure dialysis treatment is subsidized under the National Health Insurance Scheme. Major Bafo Ahinkra, spokesperson for the Renal Patients Association of Ghana, has welcomed the initiative but warned that the recent price hikes will further burden patients, making it increasingly difficult for them to afford necessary treatments.
As at now, most of them have resort to one session a week. Ideally, we are supposed to have 3 sessions a week. But because of money issues, we're doing twice a week. And now the new increment, they're just doing once a week. And I keep saying if they don't take care, the mortality rate, probably from next month, they cannot stand it.
The ranking member on the Health Committee of Parliament, Kwabena Mintah Kando, had earlier expressed concern about the decision to raise dialysis costs, which he claims bypassed established procedures. True to his word, the ranking member brought up the issue in Parliament, urging Finance Minister Dr. Mohamed Amin Adam to review the price hike to save lives.
Mr. Speaker, I think that as a matter of urgency, I want to use this platform to call on the minister responsible for finance to come back, the Speaker, to come back to amend this particular act. The Speaker, because already the people cannot even afford the 380 or 370 Ghana cedis. The Speaker, we need as a state to take a decision whether to subsidize or to absorb the entire cost and not to increase the cost of dialysis in this country.
Majority Chief Whip Frank Anodompre shared his excitement when the NHIA made a significant allocation of 2 million Ghana cedis to help the needy in terms of subsidizing the cost of dialysis treatment for needy people. He also challenged the Health Committee to follow up on the allocations made by the National Health Insurance Authority to subsidize the cost instead of dramatizing the problem for political gain.
Thankfully, the proud ranking member, knows about the issues. What the committee should be doing is to pry further, get details, and inform this House for us to take a decision. Well, you can decide to come by this leg of action and raise the matter as an urgent matter, but there is more you can do as a committee. As we want to challenge the leadership of the committee, inclusive of the ranking member, that after the provision of the 2 million by the NHIA, in the course of passing the formula, that dedication was made. 2 million allocated. What can be done more in this regard to resolve the problem? And for me, Speaker, that is what should be engaging our sentiments and concerns.
Admitting that the price increment in dialysis cost was a mistake, the chairman of the Subsidiary Legislation Committee of Parliament, Dr. Dominic Aine, gave assurances that they would correct the error.
I told them that there were a lot of errors and time had run out on us, and therefore they should bring an addendum for us to correct the errors, including this issue of dialysis. I told the honorable member for Joaboso that this was where we were with the issue. There are a number of them, and the honorable Abinao said they are preparing to bring the addendum to Parliament. So we correct those errors.
The Speaker has since directed that the Subsidiary Legislation Committee engage stakeholders to address the issue.
So what I can say is to apply Order 93, Rule 6. I will direct the Subsidiary Legislation Committee just to follow up to the agencies involved and hold some discussion with them to see how some action could be taken in this matter.
Mr. Ahenkwa says although the news is welcoming, Parliament should expedite the processes to aid renal patients.
For all that we know, for all that we need, is that we wake up one morning and they say, oh, dialysis is free. Or maybe when you go, government is taking maybe about 70%, go and pay 30%. So let's say maybe I'm going, I have 100 cedis. I will just pay 100, government will take the rest. And that will cushion us. Because I keep saying, apart from the dialysis, it's not only the dialysis. Oh. We are fighting about dialysis. That it's not only the dialysis. We have medications that we take. We have injections that we take from here to Kolebu. Let's say I'm coming from Tessaron here to Kolebu. I cannot go by trotro. Sometimes, maybe I always say that God has been so good to me, and maybe I'm taking very good care of myself. So maybe when you see me, if I don't tell you, you wouldn't even know. But most of the people have to take Uber, drop it to that place. When they have to take Uber, drop it back home. So you need an additional about 500 or 600 aside for the 4 another you pay. So we are just praying that they should come out something positive.
Whether the minority is raising the issue for political gains, as alluded to by the majority chief whip, lives are at stake, and the cost of the critical dialysis needed to keep renal patients alive has risen, an increase most cannot afford. Reporting for Citi News, my name is Eno Safo.